Everybody.
All right.
I'm Charles Shapiro.
Very good.
I'm the president of the World Affairs Council of Atlanta. Welcome to our Zoom program today with former Senator Tom Daschle in conversation with Clyde Tuggle. Program is brought to you today in part by the UPS Foundation and by the Atlanta Global Studies Center. We are grateful for that. Just an administrative word before we start. We're going to have everybody except for Senator Daschle and Clyde Tuggle, have them muted and their cameras muted, although Clyde looks like he just got muted somehow, so we got to unmute him. There he is, he's back. Okay, Clyde, unmute yourself. And if you've got questions, please use the chat function at the bottom of your screen. If you put your cursor down at the bottom, you'll see chat. Send questions to me, Charles Shapiro. I'll combine them, make them a little bit shorter, and I will ask at the question period, hopefully at around 5:30. I'll ask the questions to Senator Daschle, maybe a couple for Clyde as well. Clyde Tuggle, apart from being a board member of the World Affairs Council, is a co-founder of Pine Island Capital Partners, an innovative private equity investment firm, he says. Clyde spent over 30 years at Coca-Cola, where he was Senior Vice President for Global Public Affairs and Communications. He's a former chair of the World Affairs Council and was a founding board member. And he's a good personal friend. So Clyde, I'm going to turn this over to you.
Great. Charles, thank you very much and welcome to everybody. And thank you, Charles, to you and your team for organizing this, and welcome, Senator Daschle, to the World Affairs Council of Atlanta. We always like to brag that we are the best World Affairs Council in the country. We're going to have an interesting conversation today with you about a number of topics related to COVID-19 and what's going on in DC. But just by way of introduction, I've known you, Senator Daschle, for a number of years. We are actually neighbors in Washington, and Senator Daschle is also a partner with me in the investment group that Charles referenced. The Senator is the founder and CEO of the Daschle Group. As many of you know, he is a native of South Dakota, first elected to the House in 1978. And then to the US Senate in 1986. In 1994, he was elected Senate Democratic leader. Interestingly, a piece of history, he is one of not only the longest serving Senate leaders in history, but is only one of two senators to serve twice as both majority and minority leader. When I introduce Tom, I often use the word common ground, because the theme that runs throughout his storied career really is about common ground. And we'll talk a little bit about that today. I think of one important note here. In 2007, he joined Senators Mitchell, Dole, and Baker to create the Bipartisan Policy Center, which is a wonderful organization that's dedicated to finding common ground for some of the pressing public policy challenges of our time. And there's probably no greater one than the one we're going to talk about today. I want to start, Tom, really, and maybe you can reflect on the op-ed that you and Senator Frist co-authored for CNN, which focused on the importance of U.S. engagement and leadership in the global effort to contain and ultimately defeat this horrible disease. And maybe just start by taking us up to 30, 40,000 feet, because you've spoken often about the only way we're going to do this is that we do it in a global way. And maybe reflect on that piece that you did for CNN. I think it's a wonderful piece. So over to you.
Well, Clyde, thank you, first of all, for that very generous and warm introduction. Charles, thank you for inviting me. I appreciate all the work and the participation and engagement the World Affairs Council in Atlanta has so ably demonstrated these many years. So it's a real privilege to be with you. Senator Frist and I have worked together on a lot of issues, but healthcare has been the primary one. in that op-ed, we noted how important it was for us to recognize that this isn't just a domestic crisis, it's an international one. I was on a Zoom meeting the other day with people participating from London and Jakarta and all over the United States. And the interesting thing in that conversation is every one of us had exactly the same personal experience. The face masks, the gloves, the social distancing, the shutdowns, the orders from government to be very careful about connecting too closely. It was really remarkable. And it reminded me again of just what a global experience this truly is. Tom Friedman has a quote that I've used many, many times over the years. That is that if we don't visit a bad neighborhood, that bad neighborhood will visit us. And I think that's especially true with COVID-19. If we don't engage all over the world in ensuring that we can address this crisis in Somalia, in South Africa, in Asia, all over the world, it's going to come back. We can't put up the walls or the defenses that would prevent it from coming back. That's first and foremost. The second thing that I know this council appreciates especially is how much the world needs our engagement, our leadership, our ability to structure and guide and direct and encourage and really collaborate with. If we don't do that, there really isn't anyone else who's capable of doing that. But what Bill and I have talked about in this op-ed is that China is going to try. They're already doing it. They're doing it in Europe. Italy noted recently that when they needed help so badly, the only country that responded was China. They're now in every country in Africa helping those governments deal with the coronavirus, as well as Latin America. So we've got to be concerned about our loss of prestige, our loss of presence, and the competition with China. But I think the most important thing is we've got to think of how it will impact this country if we fail to engage satisfactorily.
Mm-hmm. Switching gears a bit and bringing us back closer to home to Washington, you know DC and you understand the intricacies and workings of Congress and the Senate probably better than anyone else. Last week you wrote an interesting piece on what life in the Senate is like these days. And so my question is maybe for the folks here, some insights on how is this working? What should be the expectation of Congress to move forward with the next phase of the health and economic recovery legislation? And what can we expect out of Congress, and what do you hope to see out of Congress over the coming weeks?
Well, Clyde, I'm going to give you an answer, but feel free to cut me off if I go on too long. I don't want to filibuster a good question, but there's so many aspects to it. First, let me talk about, I think there's both good news and bad news. That obviously we're going through a very polarized and difficult time politically in this country. There are deep divisions, and that's no secret to anybody. I would note, however, that when it came to final passage on the first four packages, the first four relief efforts, it was almost a unanimous vote. So at the end, in spite of all the bombastic rhetoric, all the polarized and sometimes inartful discussion around these options, at the end of the day, Congress pulled together, and I give them credit for that. That's the first aspect of it. We're now going into what I would call phase 5. The House introduced today what they call the HEROES Act. It's an acronym for legislation that is estimated to cost over $3 trillion. It is their priorities list, and it is comprehensive. Nancy Pelosi has argued that it's time to go big, that interest rates are so low that the cost on the debt service is probably lower than it was even 10 years ago. And so we ought to take advantage of it. Republicans have balked on that. They've argued that it's time to take a pause, to look and assess our circumstances and make some decision a little later on. maybe in a month or so before we make another move. And they also have noted that if we're going to move forward on anything, especially on assistance for state and local governments, that there has to be some liability protection for business. So the two sides, once again, are quite a distance apart. We go through a lot of phases: early position, red lines, compromise, more red lines, further compromise, and ultimately consensus. We're in those early stages, and it could be at least 6 weeks, maybe 2 months, before we finally reach some resolution. I can come back to that if you want to drill down a little bit more on the substance, but that's where we are procedurally. There's another interesting development going on, and I may end with this. We're going through a real technological revolution. Today was historic, Clyde, in that the Senate held its first virtual hearing. People from all over the country. It was the Help Committee. Lamar Alexander was chairing the committee from his home in Tennessee. His dog Rufus was barking in the background as 4 witnesses from public health were testifying from their homes, mostly from their homes as well. Senators spoke, and it was really quite a remarkable experience. You've seen the future when you saw that hearing today. I think there is every likelihood that remote voting, proxy voting, and remote hearings and virtual hearings of this kind are going to become standard practice in Congress. And today history was made as it was done for the first time in the Senate.
Yeah. So it's $3 trillion plus that's been spent. Who knows? Several trillion yet to come. We are staring down the barrel of economic collapse. Is the government doing everything it can in terms of the economic stimulus? I mean, it's an unfair question, but if you are still in the Senate, are there things that you see from your perspective now that you think the government, and particularly Congress, should be looking at above and beyond or different from the current approach to economic stimulus?
Well, Clyde, I think, when you think about it, there is such a close correlation between health and economic challenges. Tony Fauci and Robert Redmond and many others today made exactly the same argument, that you can't begin to address the economic recovery until we've addressed the health recovery. And so, as frustrating and as uncertain and as profoundly troubling as it is, we've got to address the health side of things before we can adequately address the economic side of things. But I think when you think about all that we've done, $3 trillion so far, perhaps double that before this is over, maybe even more. I don't think there's any question that we are doing everything that one can from a fiscal policy perspective. I would also argue that I give the Fed a lot of credit. They've done virtually everything possible on monetary policy to coincide with fiscal policy. So we've done far more than we did in the Great Recession just 10 years ago. And so I think if there are things that I would highly recommend as we think of the economic circumstances going forward, there would be 2 in particular that I would hope that Congress would look at. First is one we've already touched on, and that is, let's not forget the international aspects of this. We've got to do all we can to ensure that we engage globally. We've got to look at trade laws, and we've got to look at the barriers we put in place to trade. We've got to do everything we can to reignite this economy and remove every barrier there is to international globalization. And I hope that we recognize how important that is from an economic as well as a health perspective. The second thing domestically that I hope we'll do is at some point consider infrastructure. That's been off the table so far. The president has noted that he could support $2 trillion in infrastructure investment. The House has come up with a bill that totals almost $1 trillion. In the past, we've been, as I'm sure everybody in the listening audience knows, we've been troubled and understandably so by the need for offsets. Well, offsets have been put aside for the moment, And maybe this is the time to diminish their requirements regarding offsets and really look at how infrastructure can improve economic recovery. We learned that lesson in the 1930s with Franklin Roosevelt. The incredible record that we built in the 1930s, I think, was largely responsible for our recovery until World War II. It was all, if not all, almost all around infrastructure. Dams, hospitals, bridges, roads, highways. They're shovel ready. They can employ millions of people, and I think there's a lot we could do to bring this recovery around more quickly if we looked at infrastructure.
Mm-hmm. So let's turn to healthcare. It's a topic that you are probably one of the great experts on based on your, again, congressional experience and your practice now, which largely centers around healthcare. What's going to change about the healthcare that both from an insurance and coverage point of view, but what can we expect about healthcare policy to change as a result of this crisis? Or perhaps what would you hope would change coming out of this crisis? I'll put that twist on it.
Well, Clyde, first of all, I think the most important thing is we've got to be better prepared for the next one. And incredibly, and I hate to even suggest this, but we know it's true, there will be another one, just as there have been ones in the past. We have to hope it won't be as far-reaching, as consequential, and as impactful, but it could be every bit as impactful, and we've got to do a better job. We weren't ready for this. If all we can do after 2 months is talk about face masks and social distancing, we're in trouble. We've got to develop a governmental infrastructure to address a pandemic proactively a lot more aggressively than we have. That will mean a government reorganization to start. So I would start with that. But I don't want to skip over what we've got to do between now and the end of the year. We've got to figure out a way to improve our testing capacity. We're still under 1 million a week. We've got to get up to 30, maybe 30 million. Harvard has suggested that 30 million a week is an appropriate goal. So we've got to do a lot with that. We've got to do a lot with contact tracing. We haven't even begun to scratch the surface on that. And then, of course, we've got to look at both therapies and vaccines. We're making progress. We don't know just what the time frame will be for progress on therapies and vaccine. We're hoping that maybe for emergency use purposes, we could have a vaccine as early as fall, but we don't know that either. So we've got a long, long way to go to deal with this issue. But from a health perspective, what also troubles me a good deal is the insurance side of things. We now have what may be 25% unemployment. We may have over 30 million people unemployed, maybe more, probably more. And as that unemployment number continues to rise and uninsured along with unemployment becomes an even greater problem, we have to worry about the actuarial balance that we have right now in our insurance system. We've got about 160 million people that rely on private insurance through their employers. That's not going to last forever. So we've got to figure out, what are we going to do when that actuarial balance is totally destroyed? How do we come up with ways to actually ensure that people can be insured going forward? So about 50% of the people are insured privately today. About 50% are insured in one of our public programs. We've got a mishmash, what I like to call a collage of subsystems. We don't really have a complete system in our healthcare today. We have a collage of subsystems that are both public and private. I look at healthcare, and you've heard me, you've seen some of what I've written about healthcare looking like a pyramid, where at the base of the pyramid, we have public health and primary care, and we work our way up that pyramid until at the very top, we have the most sophisticated forms of healthcare, and that would include MRIs and heart transplants. Most countries start at the base of the pyramid and they work their way up until their money runs out. We in the United States start at the top of the pyramid. We work our way down until the money runs out. And our pyramid at the base is very sparse. We don't have much public health. In fact, public health has been cut by more than 25% just in the last 10 years. So we've got to put real focus on the base of the pyramid, the bottom of the pyramid, on public health, on good primary care. We've got to address that real dysfunction in our healthcare series and collage of subsystems if we're really going to fix our total infrastructure going forward.
So one final question, then we'll open it up to the audience. You have written extensively about how life has changed in such profound ways, and I'm just curious for you personally, what do you think will change in terms of your day-to-day life coming out of this?
Well, Clyde, I think first and foremost, the way we look at work and the way we look at our social interaction may change a lot. I noted the other day in one of my reports that as a politician, you can't live without shaking hands. I haven't shaken a hand in over 2 months. Social distancing is part of life right now. My guess is that we're going to look at the way we interact much more differently. I think Zoom is here to stay. I think the travel we have taken for granted in the past is likely to diminish. My guess is we're not going to need nearly as much office space as we did 6 months ago. I suspect that we're going to look at education in an entirely different way. Teaching methods are going to change. Virtually every aspect of our lives, whether we fully appreciate it or not today, has changed profoundly and permanently. And I think we're just only beginning to appreciate how profound that change is. I'm not sure theaters will ever be the same again. I don't even know if Broadway is going to be quite the same as we look to the future. So pick the industry, pick the sector of the economy, and I guarantee you every single sector of the economy is going to look a lot different a year from now than it did 6 months ago.
Terrific. Thank you for those thoughts, Senator. So Charles,
let me jump in.
We see what's on the minds of this group here.
Okay, good. Meg O'Brien asks, how are we going to pay for this? If you're talking $6 trillion, that's something like what, 30, maybe 35% of GDP. How in the world are we going to pay for this?
Well, Megan has a very, very good question. We also made history, as probably most of you know, in that we've now exceeded 100% of our gross domestic product as our debt continues to rise. It's now estimated to be well over $30 trillion and growing. And while the debt service right now is maybe lower, we can't expect that to continue. And I think there's only really 3 parts to the answer, Charles. I'd like to think we can grow our way back to some degree of economic viability, and to a certain extent we can. But in the old days, and unfortunately those old days are getting older, there was a recognition that if we're going to really address the debt, we had to look at both revenue and spending. And I think we're going to have to do exactly the same going forward. We're going to have to look at forms of revenue. We're at around 16% GDP right now with revenue, and we're at about 24, 25% GDP with spending. We've got to close that gap. Right. Bring spending down, raise revenue, and hope that our economic growth can continue.
Armstrong Sue asks from the international side, what does it say about the United States that countries like South Korea, Germany, Taiwan have done better in containing COVID-19 than the United States has?
Well, that's certainly true, and I've bragged on Taiwan in particular. They don't get much credit, and they're not even in the WHO, as you probably know right now, and yet they've done a remarkable job. First, I would say in our defense that we have a far more complicated set of circumstances than they do. Our population is much more diverse, it's much larger, and we have many challenges that virtually no other smaller country has to concern itself with. But at the same time, they were better disciplined. They had, frankly, if I could say it, they had better national leadership in that they recognized the importance of taking these very, very strict proactive measures, and they did a better job of enforcing and engaging. That has had extraordinary consequences in a positive way. South Korea, just as you probably noted yesterday, had a few new cases, and that's caused them concern. And right away, they're going right back at it again, doubling down to make sure that it doesn't repeat itself. I think we all have to be concerned about second waves, and we're beginning to see indications of that already in some of these countries. So, but I think in short, they had very, very good leadership, and that's quite laudable.
Mr. Robert Thornton asked, when you're talking about infrastructure, what about hospitals and healthcare in rural areas? I mean, where doctors are few and far between, hospitals are running into terrible financial problems right now. A number of them are closing down. Is that part of, when you talk about infrastructure, is that part of what you're talking about?
Well, I appreciate the question, because the Bipartisan Policy Center is hosting a webinar on that very question on Thursday, and I'm sharing the webinar. So I'd invite any of our participants just to check in with the BPC website, and you can get the details there. The short answer is absolutely. They've been impacted dramatically. We just had a session today where from hospital and rural health experts from all over the country, and they reported that we're not going to peak out in rural America until September at the earliest. And we've already lost 600 hospitals in the last 10 years, rural hospitals. We're seeing a wave of potential closures in the next few months. So it is critical. And I think we're going to see a fairly profound change in our rural infrastructure for health as we go forward. Telehealth is going to be a very, very big part of how we provide care going forward. Our community health centers play an invaluable role. We have over 60 community health centers in the two Dakotas, and they are just invaluable. So clinics, telehealth, some form of emergency transportation, all is going to be necessary, but we're beginning to see the toll that it's taking on rural hospitals, and it's just extraordinary.
In the urban areas, healthcare workers who are not dealing with COVID are being laid off because people are putting off elective surgery. I mean, I get notices from my dentists and doctors saying, don't come. How do we put all this back together after this is over? What's it going to look like in a year from now?
Well, I don't know that anybody really can say with any authority. I do think that it will come back. We need those services. And I'd go back to the bottom of my pyramid again and say, I think it's really going to be important for us to recognize the importance of primary care. I have a fantastic primary care physician in Washington, and he's beginning to provide telehealth services himself to his clients. And I think that's something that's not only going to be prevalent in rural settings, but probably in urban settings as well. So I think you're going to see that. My guess is you're going to see more of a integrated system than we've had before. We may see more expanded scope of practice where physicians' assistants, nurse practitioners, and pharmacists play a more important role. But those services are going to be necessary with chronic conditions continuing to be the prevalent form of health care in this country, with about 80% of our care is chronic related. We're going to need those providers just as much in the future as we've needed them in the past.
Dr. Jesse LeGros, who works at CDC as a public health, both doctor and has her PhD in public health, asked if you have any idea on how to equitably distribute a vaccine globally once it's developed.
Well, that's a terrific question too. I wish I did. I think I'd state the obvious first. Obviously, our health providers and first responders and those who are most vulnerable are going to be a high priority and ought to be a high priority. But we also, as a wealthy nation, have to take into account that there are perhaps billions. I don't know what the exact number is. There are billions of people around the world today that can't even access fresh water to do one of the most basic things, to take preventative measures on coronavirus. And we have to think of the vulnerable in context not only related to health, but social conditions. So we're going to have to be very, very judicious and very thoughtful about how we distribute. We'll have to ramp up as quickly as we can. We can only hope that that our production capacity can match the demand. And I am encouraged by reports that I've gotten that we're already ramping up production infrastructure in order to more rapidly respond to the demand that we know will exist once a vaccine is developed. But it's going to take a lot of wisdom, a lot of thoughtfulness, a lot of humanitarian spirit to be able to do this right.
Solidarity seems to be in short supply these days. I mean, there's going to be a huge demand in the United States that our citizens get, if it's the US company that develops the vaccine, that our citizens get the vaccine first. I mean, how do we deal with the world population, our own population? Presumably Germany will feel the same way, and China the same way about their own citizens.
Well, I think you raise a good question. And I think, as I say, it requires some leadership. I think we should also not assume that we're going to be the first ones to develop a vaccine. China could be that country. We're seeing rapid progress in Europe as well. We've got, as I understand it, over 180 efforts underway to develop a vaccine today in places all over the world. Not everybody has production capacity, and nor should they have. But so we have to assume that, first of all, we may not be the first to develop it and may not have a control over that question. But whoever does, your point about solidarity and the need for cooperation and interactive engagement has never been more critical. This is a global challenge, not a domestic one.
Robert Thornton asks, oh, I'm sorry. I got the wrong person. I apologize. There's a gentleman named Steve Markham. Is there a country's healthcare system that you think could serve as a model for the United States?
Well, I don't know that any one country serves as a model because our circumstances are so different.
Right.
We're arguably the most diverse country in the world. Our circumstances here are vastly different, as is our history. We've had this hybrid of subsystems now for almost 90 years. And we have to recognize that history has a legacy, and we have to acknowledge that legacy as we go forward. But I do think we have to embrace change. We have to recognize that we're going to have to segue to some broader range of services and insurance products that accommodate the actuarial imbalances and crisis that we're about to face. I don't know what the solution is. My guess is that some form of a public option as a segue may be in the offing. I have no idea. I know there's still a lot of opposition to more government engagement in health insurance on the part of some. So there's no way to predict with any accuracy, but I do think that it's going to continue to evolve, and we are going to be put in a very challenging place to not only address the healthcare needs, but the health insurance needs the nation will face in the coming years.
How do we get there politically? We all know that there are issues we need to deal with, whether it's infrastructure, immigration, healthcare. How do our education system? I mean, okay, we can all point out the issues, but we seem to be so divided politically. How do we reach a consensus?
Well, first of all, I think we just need a little bit more cooperation and comity. Trent Lott and I wrote a book a couple of years ago called Crisis Point. We laid out our predictions, our own view, our forecast of governance and democracy if we don't come together more effectively. And we offer a number of solutions to addressing the need for greater comity. But it starts with that. I have to say it begins, Charles, with leadership. Leadership on both sides, a recognition of the need to do this. At the end of the day, democracy has to deliver. Democracy is on trial right now. Autocracy is on the rise in places all over the world. People are beginning to wonder about the efficacy of democracy. And if we can't show through our own example and our own leadership that democracy can deliver and provide solutions in a meaningful and comprehensive way, then I fear for democracy, not only in our country, but worldwide. So it's more than just how we address the challenges, it's whether we address them in a way that can accommodate our values around democracy and this democratic republic for generations to come. So this is a big, big trial for us. And I hope politicians understand that. There's a group in Congress today called the Problem-Solvers Caucus. It's made up of half Democrats and half Republicans. I wrote a piece this week about the Problem-Solvers Caucus held a mock session in the House a couple of days ago where 20 members participated, all virtually, all from remote locations, and demonstrated how you could do it in a meaningful way. But they've come together on a number of issues, half a dozen or so issues that they think offer solutions to many of the challenges we face in a bipartisan way. We need more problem solvers. We need more people willing to show some courage and come together and demonstrate the comity and the need for consensus is really key to democracy. Compromise is the oxygen of democracy. I'll just repeat that. I think compromise is the oxygen of democracy, and we don't have enough oxygen today.
Well, we're about to have a primary here in Georgia, and our primary systems tend to elect people who are don't embody those qualities you're suggesting. So whichever party it is, the primary system tends to favor the person who's on the extreme of that party. So they get to Washington. It's very hard. I'm telling you, you spent a career in Washington. I mean, how do we do that? How do we bridge the gap?
Well, I think we're going to have to reform our system. It's always careful what you wish for. We thought primaries were really the antidote to the smoke-filled rooms we had in the 40s, 50s, and 60s, and everybody went to a primary or a caucus system over the course of the last 30 years. And frankly, I think it's really been a failure in many respects. Very few people, the average turnout in a primary is around 20%. That means 80% of registered voters don't even participate. That means that those who are usually hard right and hard left are the only ones standing in a primary, and that presents a very distorted picture of what our nominating process ought to look like. So we've got to figure out a better way. I think trying to encourage broader participation, I'm one who believes that remote voting, mail-in balloting could help participation. We ought to consider that, especially this year. 6 states do it exclusively. All 50 states do it in some form or another. But we've got to find ways to either broaden participation or find some addition to participation through primaries and caucuses as they exist today.
Ask about food security. I was talking today with a business executive for a company that buys and sells protein around the world. And he's saying there's inflation, food inflation is growing rapidly right now. And that there are a number of developing countries that are going to have a really hard time feeding their people because of disrupted supply chains, day laborers who aren't working. In your conversations with your folks around the world, I mean, what do you see? Where are you particularly worried?
Well, I happen to serve on the board of the World Food Program USA, and so we have a tremendous concern about the implications of your description and what we look to as we consider the future. We have just an enormous problem involving hunger around the world. About 1 billion, about 1 out of every 8 people in the world go to bed hungry every night. Nutrition among children is a real problem now that we've lost the school lunch and breakfast programs around the world. They don't have access to nutrition programs that existed while school was in. That's especially true in this country, but true all over the world. Right. We have real distribution problems, not to mention production problems with all of the serious concerns we ought to have about meatpacking plants and other facilities involving processing that that require very close proximity for the workers. So we've got safety issues, transportation issues, distribution issues, and real shortage issues that all are being compounded dramatically almost by the week as we look at the worldwide implications of hunger. What I worry about a lot going forward is are the social implications of this. We've so far been very fortunate in that we haven't seen much social disruption, but that could come about just as we saw at other times in our history and the history of other countries, if dissatisfaction around many of these issues continues to mount, with dissatisfaction and frustration with governments continue to be exacerbated. So we have to be very concerned from that point of view as well.
It's a tall order. I've got a final question here, for a comment and a question. So I got a great comment from Armstrong Sue, says, what we're doing here right now is the way to educate people, and congratulating us and the people on this call. So I'll take that as a compliment, and I hope you will as well. One of my colleagues asked, do you want to make any predictions about November?
Well, I know, I'm sure we have a bipartisan audience, and so I think in normal circumstances, in a crisis, the incumbent usually serves or is served well, does well. We saw that with a number of cases in the past. I think it's going to be a very competitive election. It won't surprise you as a Democrat, and one who has known Joe Biden for almost 40 years, that I hope he's our next president, but I really don't know. I think it will be a close election, just as it was the last time. I think it's almost completely unpredictable as we wait to see how COVID unfolds and how this government and our states respond across the board. You know, it's not only a presidential election, as you well know, Charles, but it's an election involving the majority in the Senate, the majority in the House, governorships. So there's a lot at stake. I just hope everybody online, and I'm sure I'm speaking to the choir, understands the importance of participation in this election. And I hope our engagement, our participation is at record highs. If it gets to 70%, nothing would please me more.
That's great. I want to thank you so much, Senator Daschle. This has been a terrific way to end the day today. This has been great, great conversation, great discussion. Clyde, you're a terrific interviewer and moderator. I want to thank you as well. Don't hang up yet, y'all. I've got a couple of things. Tomorrow at noon, we've got a program with Dr. Jagdish Sheth, who's professor of marketing at Goizueta Business School, and he's going to talk about the future of retailing. And by retailing, he doesn't mean just stores. He means everything that you see at a strip mall, whether it's a vet's office, the dentist's office, the doctor's office, the banks. So it's going to be terrific. So please join us tomorrow. On Thursday, we have Brad Allison, who is the CEO of AJC International. AJC International is the global supply chain. They're the company that buys chicken, pork, beef, French fries from in 129 countries around the world and sells it. And he's going to explain why there is no chicken at Publix. So if you want to know why there's shortages, Brad's going to explain it. Next week, May 19th at noon, we have Mary Street with 2 E's and 2 T's. She is BP's Senior Vice President of U.S. Communications and External Affairs. We're going to talk about the energy industry with oil prices at rock bottom. And then May 20th at noon, we have Fred Hochberg, who I bet you know, Senator Daschle, who's talking about his book, Trade is Not a Four-Letter Word. So please join us next week. This is going to be great. Senator Daschle, thank you so much. This has been terrific.
My pleasure. You're welcome. Thank you.
Great. Thank you, Charles. Thank you, Senator.
Thanks, Claude.
Take care.